Tier 1 of the 4 tier levels of intervention is primary activity, and this is what the patient will experience when they go and see their GP or their nurse, but it may also include their pharmacist or leisure services or anyone who's competent with weighing scales and a tape measure to calculate whether their BMI suggests they're overweight or obese. At that level, the whole point is to identify whether somebody's at an unhealthy weight and to give initial advice on how to manage that, and if they're motivated, refer them into the appropriate tier of intervention. Tier 2 of the weight loss interventions is your community weight management program. So this is a structured weight management intervention, and it's commissioned by the local authority in that region, and it may involve a local team of specialists, or it might be commissioned by a commercial provider such as the likes of Weight Watchers and Slimming World. And normally it's an education-based group intervention where there'll be a classroom approach for a time-limited amount of time, typically 10 or 12 weeks, where an individual is taught and educated about diet, lifestyle, nutrition and physical activity. Tier 3 is intended for patients who might be unsuccessful at a Tier 2 weight loss intervention, but also specifically intended for those patients with a BMI above 30 with a comorbidity. And what that means is they're obese with something like diabetes or heart disease, or they might be morbidly obese with a body mass index above 40. Tier 3 is the multidisciplinary team approach that's done in a specialist centre and is intended as a one-stop shop of all NHS approved and evidence-based interventions, and will have a group of specialist individuals that can tailor individualised care for that patient. What we've seen within the NHS over recent years is more partnership working with the commercial sector, and this is vital for effective weight management services. We've already seen it in some areas in a Tier 2 setting. What we should be seeing is CCGs working with the commercial sector for helping to provide Tier 3 services as well. By working in conjunction with someone like LighterLife, it can provide that crucial very low calorie diet intervention, but also the behaviour change intervention as well. Tier 4 for most adults will be bariatric surgery. When a patient first attends a Tier 3 service like Rio, they will be met by the specialist healthcare assistant first to do the appropriate weighing and measuring on specialist equipment that does more than just pop them on some scales and find out their weight. It might identify the weight of their bones, their muscle, their fat, whether it's dangerous fat. In addition to that, in their first appointment, they will also see one of the obesity specialist nurses who has a key role within the team, because between them and the healthcare assistant, they need to get to know that patient and tailor an intervention that's specific to them. An ideal Tier 3 multidisciplinary team service would include specialist healthcare assistants and obesity specialist nurses. It would include health trainers and talking therapists to address the psychology. It would also include specialist dietitians and possibly a cook and eat team to deliver group sessions for patients. It should include physical activity specialists or exercise therapists, in an ideal world in an on-site gym facility. And as well as that, it should include a GP for looking at weight loss medications, existing medications, or any appropriate referrals that are needed. We feel that the talking therapy aspect, or the psychological side of why we overeat when we're not really hungry, is the key and most crucial part of the intervention. It's very easy for somebody to lose weight. If they just don't eat, they will lose weight for whatever reason. Whereas if you don't address the underlying reason why they became overweight or obese in the first place, then as soon as they stop on that diet, they'll put all of that weight back on. So we need the talking therapy intervention to identify the reasons why they became overweight or obese in the first place and teach them techniques to break those habits. The reason why I'm a big fan of LighterLife as a provider of VLCDs is because, as well as having an effective and proven weight loss intervention, they also incorporate within it their version of a talking therapy or cognitive behavioural therapy that introduces the necessary behaviour change that results in sustainable and lifelong changes in a patient's lifestyle that prevents weight regain. The recent NICE quality standards for obesity management that came out in 2016 now actively recommend talking therapy as part of the NHS intervention for weight loss. LighterLife recently did the most comprehensive mapping exercise that's ever been done for these Tier 3 centres, with 211 Freedom of Information requests going out to all of the England and Wales CCGs and Scotland health boards. And unfortunately, of those that replied, there was still a huge amount that either didn't know it was their responsibility to commission these specialist weight management services, or many didn't have availability to them or had to share services with other CCGs, or what in some people's opinion is even worse is that Tier 3 intervention was delivered by the surgical centres, where if you take into account that the Tier 3 intervention is supposed to be medical intervention to prevent the need for going on for surgery, we don't want the surgeons to just spend their time working patients up towards bariatric surgery without having tried everything else. Regrettably, because we don't have a comprehensive nationwide arrangement of availability for Tier 3 services, we therefore have a postcode lottery once again in terms of care for the patient. Some areas may have Tier 2 and Tier 4 availability, but without that Tier 3, the whole pathway falls down. There's several possible reasons why some CCG areas might not have Tier 3 services. One might be, as we've identified, they don't even know that it's their responsibility, which is a shame because this has been established since 2014. The second might be that they just don't have the money available and they haven't budgeted for this, which, given the cost effectiveness of treating obesity, is regrettable. The third reason might be that they have the money but they don't particularly see the advantage to them in terms of a financial gain. In Rotherham, as an example, we're quite fortunate in that we've been going for a very long time and we had projected figures of numbers of patients that were expected to end up going for bariatric surgery. And since the introduction of our Tier 3 service, we've seen a dramatic fall in those numbers. If a CCG invests heavily in a good, effective Tier 3 service, they will reap the financial benefit. The more comprehensive the Tier 3 intervention, the more likely we are to get a beneficial outcome for the patient.